We're going to be presenting you with alternatives in medical care, alternatives to conventional medical care. There are many branches of the healing arts, including classical homeopathy, chiropractic, acupuncture, herbology, nutrition, psychology, as well as body movement techniques. We want to empower you with choices that you can make as to how you receive medical care for not only physical complaints, but emotional issues and spiritual healing as well. Today we're going to be talking about obesity and depression. Obesity in the first half of our program and depression in the second, so we hope you'll stay tuned. This program will air about twice a week. We'll shoot a new program every 2 weeks. We have a clinical nutritionist with us today, and we're going to be asking her lots of good questions about obesity and depression. I'll be interjecting with information, and we'll have tidbits for you, information that you can use in your daily life to gain better health, maybe things you can get at the health food store. Our goal again is to empower you. So let me introduce our guest today. Janara Iman is a clinical nutritionist, and thank you for being on our program.
Thank you, Dr. Thomas.
Tell me, when somebody comes into you, and I know you've talked to many people about how, what they can do about what they eat and how to get healthier, but you must see some common trends develop as you see these people. So for example, say somebody comes in and they're 10 or 20 pounds overweight, and you begin to ask them what they eat. What kind of things, what kind of mistakes do you see that they're making right from the get-go?
There is a common pattern when there's an obesity factor involved, and that is that the majority of them are eating an overabundance of highly refined carbohydrates, the combination of poor fats and sugars, which are lethal to your cholesterol level and triglyceride levels, instead of good high-quality fats, which are known to actually reduce the LDL cholesterol and improve the HDL, or the high-density lipoproteins, which are nature's Band-Aid. And when we're eating these highly refined carbohydrates and sugars, we're looking at a very high glycemic load on the body, and this leads to inflammation, heart disease, syndrome X, which is insulin resistance, and diabetes, type 2 diabetes. And pretty soon, the body is so used to getting and metabolizing these highly refined sugars that it begins to store protein and fats in the body as fat instead of utilizing them as nutrition. And I think that is a huge factor in obesity, as well as, you know, the ordinary hereditary factors and metabolic rates.
So what are the most common mistakes that people make in what they eat?
The most common mistakes would be a lot of bread, a lot of pasta without a good quality fats. There's a lot of emphasis that I put when I'm talking to somebody on glycemic index and glycemic load. And glycemic index is simply a measurement of how quickly food is metabolized into sugar into the bloodstream. And the load is basically how that affects the metabolism, and there's factors of whether or not there's fat and fiber involved. And so
what are the foods that are highest in glycemic index?
The highest glycemic index, believe it or not, is not sugar itself, but it's particularly white bread and refined foods. So your average cornflakes is 92 on the glycemic rail if we're going from 0 to 100, whereas oatmeal, old-fashioned oats, is around 42 to 45. And
so
is
if
low.
somebody were having a lot of bread in the morning,
yeah,
or cornflakes, they could switch over to oatmeal.
They could switch over to oatmeal. They could offset that by just simply using unrefined carbohydrates such as cornflakes, and having a little dietary fiber in the whole grains, and an addition of natural fats as well.
Now, I like to get up and have natural fats for breakfast. I like to have a couple of eggs over easy, maybe some bacon or some sausage with that, and some granola or oatmeal. What do you think of that?
Well, you've got a high fat load and a high glycemic load, but you're combining them together in the body. frankly, I wouldn't be able to digest that. But you know, if that's your preference, the one thing I can say is that the whole grains in your granola, minus the sugar, is offsetting.
Right, because whole grains digest more slowly than refined grains, so that lowers its glycemic index.
It lowers the glycemic index.
So when you have people coming in who are overweight, are there emotional components to that as well, or is it just a wrong choice in foods?
I think there's an emotional content to everything. We are a combination of physical, mental, emotional, and spiritual beings, and they all play into each other. And quite a bit of people that I see that have a problem with being overweight or obesity are people who are highly stressed or have emotional image issues due to our social and cultural influences. You know.
Well, as a classical homeopath, of course, I'm not only asking people about their physical symptoms, but I'm asking them about their emotional self and sometimes about their mental concepts too. Because if somebody has a concept that I have to follow the food pyramid, well, you know, the base of the food pyramid is mostly grains, and so they're going to think that they have to have a lot of grains in their diet. So, but I tend to want to concentrate more on the emotional issue behind the obesity. So we find sometimes in homeopathy that a person has had a sexual issue in their past. Maybe there was molestation, maybe there was a date that went wrong, something where the person actually desires to be less sexually attractive to the outside world. Do you find that too in the patients that you treat, especially when you're thinking about some classical homeopathy that you want to do with them in addition to the clinical nutrition that you practice?
Yeah, I do see that. I also listen carefully to the patient, and you know, when you mentioned as far as looking at it from a homeopathic point of view, we do see certain characteristics for certain homeopathic personality types, but I listen carefully to the patient. Sometimes a patient who's overweight needs to be overweight to feel like they have a certain amount of protection, like you were mentioning, but what I want to focus on then is not only what is comfortable for them, but how can we get you to a better state of health? And in getting you to a better state of health, we're also working on physical health and emotional health.
So do you actually give a homeopathic remedy? Say, for example, somebody is wearing their weight kind of evenly, like a calcarea carbonica might do, which is a homeopathic remedy made from calcium carbonate from the oyster shell. If you give them that remedy, does that help them with their obesity?
It does. If we're talking about obesity in the manner that you were first describing it, a calcarea type person is a very sensitive person, self-protective. It's like the oyster shell, who, you know, protecting the pearl. If they're feeling more emotionally stable, they're often willing to take the next step to improving their health overall and improving their diet.
There's a nice little statement that goes with that oyster shell. If it gets a little grain of sand in it, it is so sensitive to the sand that it must produce a pearl around the sand in order to make it a soft substance so that they can deal with it. And we find that calcareas are like that in their lives.
In nature, yes.
Yeah, pulsatillas also have a tendency to weight gain as well. And we know the pulsatillas made from the plant, the wildflower, tend to have very rapidly changing emotions. So when you make a dietary recommendation to people, are they able to follow your dietary advice? I mean, you do dietary work where you change their diet, the foods that they choose, and then you do supplementation work with them as well, where you're giving them supplements to take. And I know you like whole food supplements, so we can define that in a moment. But what does the homeopathic remedy do on top of the supplements and on top of the dietary change that they're making?
Well, the homeopathic remedy is an energetic type of support. And energetically, a pulsatilla is one who changes a lot, who's you know, who may be laughing and crying, you know, in the same hour over the same subject, or just, you know, very happy-go-lucky. There's a definite personality type that we see, and there's an impulsiveness to a pulsatilla where you know that if they're looking at food as a relief for a stressful situation, they're going to be grabbing things very quickly. They're going to be not thinking about it. So if I was going to work with a pulsatile in addition to giving them a remedy, I would make sure that we had lifestyle things set up so that the things that they grabbed would be things that would be helpful and healthful to their own particular nature.
So for the person who likes to eat a lot of pasta, can they switch over to a buckwheat soba or other things to help them with their liking of carbohydrates?
Yeah, absolutely. Now we're talking a little bit about the difference between the glycemic index and grass seed grains. And buckwheat is not a grain in the way that wheat is, and so it's not of the wheat family, and it's gluten-free. And another one is quinoa, which is another high-protein grain that has all the 8 essential amino acids that we can't make in our body, and it has a very low glycemic index.
And I've heard that 90% of Americans might actually be gluten
intolerant.
Gluten intolerance. They might
Right.
might have a gluten intolerance, and so that causes inflammation. Tell us about inflammation and foods.
Inflammation is a huge contributor to many of the diseases that are related to food, like we mentioned before. Heart disease, insulin resistance, which is an overabundance of insulin response to an overabundance of sugar in the bloodstream. And
of course, sugars come in the bloodstream from the digestion of carbohydrates like pasta and bread.
Exactly, and some of these digest more quickly than others, and so there we get into the glycemic rate.
So the slower it digests, the lower the glycemic index.
The lower the glycemic load on the body, yeah. And so the glycemic index, which is the rate at which this metabolizes, is offset by fiber and fats and the proteins within the food. So if you're going towards a whole grain, and then, as we said, a gluten-free grain, such as buckwheat and quinoa, then you're jumping over the fence, you know, in helpful, in helpfulness to your diet. And just by taking out these grass grains that are quickly digested in your body, such as the wheat and the rice. And for instance, the white bread, which is about 70, you know, on the glycemic scale.
That's pretty high.
It's pretty high, but sourdough bread, incidentally, is only in the 50s range, which is, you know, lower, mid-range to lower. And then you add a little natural fat to this, you slow down that metabolic rate.
Avocados,
olive oil especially.
And is butter the greatest food ever?
And butter is a fantastic food.
It actually lowers cholesterol.
It lowers the LDL cholesterol in the body, and that in turn, it helps the HDL, the high density lipoprotein, which is nature's Band-Aid.
So you're working in San Rafael with Preventive Medical. Elson Haas is the director there.
Yeah.
But you also work with Michael Rosenbaum.
Correct.
And some other nurse practitioners who are there as well. So they refer nutritional patients to you.
Yes, correct. I mean, I work in a clinic where everybody's dietarily conscious. So all the practitioners emphasize diet, but if they're specifically talking about a patient that really needs some hand-holding with their diet.
And what to choose to eat, and how to shop, and how to cook differently maybe, and not microwave.
Yeah, well, that's good, another good point. But you know, I work with all kinds of patients, and some of them are strict vegetarians, some of them really just don't have the right idea of how to incorporate the proper foods. And getting back to the inflammation, that often leads to food allergies and other food sensitivities.
Inflammation is bad.
Inflammation is bad. It's a marker for all kinds of diseases, and we know this now. Yeah.
If you're watching our program and you've just tuned in, I'm Dr. Cyrus Thomas. This is Homeopathy and the Science of Healing. My guest is clinical nutritionist Janara Iman. Switching over to depression.
Yes.
Of course, if a person's sugar levels are going up and down dramatically, they're going to have moments of chronic fatigue, many moments of chronic fatigue during the day. Their sugar is going to be spiking, it's going to be dropping, they're going to go for coffee and candy bars, and they're going to want bread sandwiches and all of that. But I have a good story in homeopathy about depression. There's a remedy called aurum metallicum. You know the remedy. It's made from gold.
Right.
That's the Latin for gold, aurum metallicum, and it's great for somebody who is suicidal. If they will agree to take this remedy, wait 15 minutes before they do anything, it's very likely they won't kill themselves. Now, I have a story where a patient was seeing me. He was suicidal, and I was working with him homeopathically, but I gave him aurum metallicum, and I said, look, if before we get to the solution of your problem, you decide you want to leave, take this remedy and promise me you'll wait 15 minutes. So he said, okay, I will. He came back one day and he said, I went up into the woods, I had the shotgun, I was ready to go, and I remembered what you said. I took the remedy. 15 minutes later, I didn't feel like killing myself anymore. And just then, his sister pulled up in a Jeep. She found him in the woods because she knew what he was probably up to. So the synergy of the whole situation was just wonderful. Tell us a little bit about the remedy Ignatia Aymara.
Ignatia Aymara, that is a remedy that we, first thing that comes to mind is if you've had a recent stressful situation, like a family member died, you're feeling grief. It's the go-to remedy for that situation. If your dog dies, take some Ignatia. If you have a breakup with your husband, you know, or your wife, and you're full of grief and pain, it's a very helpful remedy for that.
I have a story of a fellow who was a Navajo Indian, and he had been left by his wife 10 years previously. He had been an adulterer many times before she left him, and he had cried every night for 10 years since she left him. So I gave him Ignatia Aymara in a very high potency, one time, one dose, and he came back a couple of weeks later and he said that evening he didn't cry, and he hadn't cried since. And it worked just beautifully. Now, it's also something people can go to the health food store and get in a low potency.
Exactly.
And take if their dog has died or their cat or somebody or there's a funeral to go to. It's a great remedy for that. And of course, people that you see who are obese, tying these two topics together, can also, if they have a lot of depression from the loss of something in the past, can go to a homeopath and get a high potency and deal with a loss that they experienced a long time ago in their life.
Yes, we call that unsuppression, and a lot of these suppressed emotions are deep-seated reasons why we hold on to weight in our body and why we're eating maybe foods that aren't good for us, but they feel comfortable and comforting. And sometimes just releasing some of those deep-seated anguishes from the past really help us open up to make a new beginning, to want to feel good again and to want to get past some of the habitual things we've been doing to suppress ourselves.
Now, depression occurs in many stages, and some have said that boredom is the actual beginning of those stages. When you're bored, you don't know what to do, things aren't quite right. It is a mild stage of sadness. And then one can become melancholy, one can experience sadness, one can be lonely, and then it can go on to grief, and then finally it can become suicidal. So we have a gradation of treatments that we can do for that. What foods lead to depression?
We're going back to highly refined carbohydrates, sugars,
it's always the
processed
carbohydrates.
Foods. Yeah, and we live in a nation where we walk into the grocery store and that's all we're going to see unless we're walking around the perimeter of the grocery store.
Well, man didn't start growing grains until what, 8,000 BC, somewhere around there.
And you know, we can get back to the Paleolithic aspects of, you know, the hunters and the gatherers and you know, the different metabolic types. And some people can handle grains better than others, but they're usually the skinny people. They're usually the
thin people.
The thin people, they need to, because grains, for the most part, especially the grass grains, are warming and wet and oily grains. that skinny people really need. The problem is that everybody could benefit from them if they're balanced correctly in their diet, especially in the whole grain form. But we have gone on to refine grains to the point of you know, non-resemblance to their original form, because we want them to have shelf life factors, and because grains contain oils that become rancid. And so we want to stay away from these rancid fats, you know, for our health reasons. But
so the best way is to mill your own grain, eat it right away.
Well, that's the best way.
But that's a little impractical in today's
But we
world.
can buy whole grains and we can keep them refrigerated.
Right.
We buy them in small quantities, keep them in the refrigerator or the freezer, and use them as we need them for that great benefit of the fiber. And they do have protein and natural vitamin B, which is one of the vitamins in its natural form that keeps us from craving sugar.
Right. So you actually recommend people taking vitamins in their whole form. So for example, instead of taking a carrot and extracting or isolating the vitamin A out of the carrot, we could take a carrot, eliminate the water and the cellulose, and make it and compress it into a pill form. We would then be getting vitamin A in its natural state with the molecules that it's normally found with, called the synergists.
Right.
So when whole food practitioners prescribe supplementation, they're prescribing substances that have not been isolated, been left in their natural form, and then you like to use systemic formulas, which incorporates a lot of herbology into those pills.
In the whole form of
Right.
herbs. Yeah.
So I find that a lot of people don't like taking vitamins, and I think it's because when they take them, they don't feel good.
They don't feel good because they're really hard on the body.
Those types of vitamins.
The non-whole food, whole herb type of supplementation actually creates stress for the body. The body has to reinstate from its own, you know, system, or the foods that it would use to repair its body, to fill out the missing ingredients in those highly processed nutrients and supplements. And you do end up with that classical phrase, expensive urine, if your body isn't doing, you know, its job. And
Expensive urine. We might also add here that if somebody is going to throw their pharmaceuticals in the toilet, not to throw them in the toilet.
exactly.
Right? Because it goes into our drinking water eventually.
Yeah.
And we're all getting some of that. So we recommend purification of water through reverse osmosis.
Correct.
Right, so you try to get people on good water too, I'm sure.
Yeah, and that's the problem today. I mean, we live in a day where, getting back to these supplements, we sometimes need to, even if our diet is really, really good, supplement it, because our food, our water, I mean, our soil is not the same soil, and the same atmospheric rain that's over, you know, polluted areas of the world rain water down even onto our organic fields.
Right.
So we've got to make an effort to eat the highest quality food possible and then supplement in the same way.
So when we're supplementing, we're actually making our food better. We're making it like it used to be 100 years ago.
Exactly.
We know that Standard Process grows its own organic produce in Wisconsin on some 20,000 acres. They also get their water for those plants from a deep, deep well. I'd like to talk about the remedy Staphysagria in homeopathy. It's for a form of sadness that is referred to as indignation. And when one is indignant, you are like, how dare they have done that to me? So I have a friend, and his Argentinian relatives in Argentina have quite cleverly kept him out of the family will. And it's his mother and his siblings who have done this to him, and that has created a great state of indignation. I gave him homeopathic Staphysagria in a high potency, in a 1,000th dilution. And by lo and behold, a week later, I said, how are you feeling about your mother? He says, oh, I don't think about her anymore. It's just not an issue, really. And he's a scientist, so I didn't want to say, aha, I think the remedy worked. And don't you think it worked? Because he would have found an argument against it. But my impression was that it had worked, and that was very nice. I've given Ignatia many times. You have too. It's a wonderful remedy. Tell us about how the subconscious is involved in food choices.
Oh, that's deep. Yeah, well, I think you know, you're talking about different personality types in a homeopathic way. And I think that we depending on who we are, our homeopathic constitutional makeup gives us a propensity to choose things according to our personality. And our personality also dictates our comfort level and the things that make us happy. Mm-hmm. And I think that all ties together. I think that we tend to choose foods even if we know they're not healthy, on an unhealthy basis, depending on who we are and how we feel at the moment, like ice cream. Ice cream is one of those foods that's known, to be something that the homeopathic...
It sure is a comfort food.
It is a comfort food, and phosphoruses love ice cream as far as the homeopathic
That's true.
type.
Phosphorus and ice cream.
Yeah, and I
have to thank you for being on our program.
Thank you.
All right, I'm glad you could come.